Well, hello and welcome to all of our viewers from around the world. I'm Fiona Langsharp, IBCLC and Director of Communications here at Gold Learning. Today, we're talking all about our Midwifery Conference, which is coming up. It's right around the corner. We are celebrating this year our 10th anniversary, so you can head over to the website right now at goldmidwifery.com to find out all the details, including we have two keynote presenters as well. And those presentations will be free and open access. We begin for most folks around the world on February 5th, but you have to go online and check all the details depending where you are in the world, of course. But do join us for our live event, which is going to be fabulous. It gives you an opportunity to really go a little bit deeper in your learning and, of course, engage with your colleagues. You'll make new friends, I'm sure, from around the world, but it's just a lot of fun and a great way to learn. Now, we know for some of you who cannot come live, you may have to come in and listen to the recordings. But of course, that's easy as well because all of our presentations are recorded for your convenience. And I will look forward to seeing many of you online. Today, I am so fortunate because I'm sitting down with Dr. Karen McLaughlin, who is going to be one of our presentations that's actually going to be live. So welcome, Karen. It's so good to have you here today.
Great to be here. Thanks so much.
And Karen, you and I were talking offline. We've been doing some pre-work, getting all ready for a fabulous presentation, I have to say. And it's such a good topic. I'm going to tease a little bit about it now because when we were doing the workup and the planning for the conference, when this came across our desk, I was just pleasantly surprised. One of those topics I just don't see very often. And I thought, why are people not talking about this more? So you're going to be talking about expanding our knowledge of the clinical management of asthma during pregnancy. Are you surprised at my response to that?
No, not at all, because certainly even as I've been part of this research, that's exactly why I started this research, because even as a midwife with many, many years of clinical experience, I myself did not have asthma on my radar. And it was only through, meeting some women with some asthma problems and also being part of a large asthma management trial that made me realize that there was a huge gap in the knowledge of asthma in pregnancy and midwifery. So that's been my mission to try and fill that gap.
Yeah, absolutely. I think that, it's one of those things that it's always at the back of our minds that it might be something that comes up, and then not really knowing exactly what to do, and what category it might put our clients in for sure. Tell me a little bit about where you are in the world, because I think this is important. Set the scene for me on what you're doing on a day-to-day, and where you are.
So geographically, I'm in sunny Newcastle, New South Wales, Australia, which is a fabulous part of the world. Lots of beautiful sandy beaches and the sun shining very brightly today. I work as a clinical midwife, still catching babies on weekends, but also I'm a researcher and academic, working at the moment at Notre Dame University
Mhm.
in Sydney, but previously I was at Newcastle University as well. So research-wise, we're still just following up with this research in regards to asthma and pregnancy management. And as you'll see in my presentation, we've launched a fantastic resource for all to use. And that's been a fabulous output from my research. So that's been
Oh,
very
wow.
exciting to see. Yeah.
Wow, that is exciting because that means that we can put those skills into place right away after your presentation. That is very exciting. So tell me the why. I want to know why asthma. How did it come across your desk? Was it triggered by something, or is it, tell me what the relationship for you and asthma is.
Really, it kind of fell into my lap in a way, in that there was a large clinical trial happening at the hospital that I work at Newcastle, and it was looking at a new way of managing asthma in pregnancy. And I actually took on a role as a research assistant on that large project. And during that role, I realized that there was actually a huge gap, as I was saying, in regards to the management of asthma by midwives. And so then I took it upon myself to research that situation, the role of midwives in antenatal asthma management. That was my master's degree, and then swore never to study again. However, I was then presented with the opportunity to do a PhD expanding on that research, looking further into the role of not only midwives, but other health professionals, obstetric health professionals in the management of asthma in pregnancy, and also the acceptability and feasibility of novel ways of managing asthma during pregnancy. So that was my PhD, which I completed in 2020. And so again, that has, for me, even as a midwife, asthma was not on my radar previous to that. I, like every other midwife doing a booking in visit, would ask all the appropriate questions. Do you have heart problems? Do you have kidney problems? Do you have respiratory problems? If they said asthma, I'd tick the box yes and move on. There was really nothing else that was done, unless they were, blue and short of breath in front of
Sure.
me. It wasn't really something else that we had a particular referral pathway or, good knowledge of what to do next from a midwifery point of view. So that's how it sort of all came about with me. And so I then realized that it was an area that really needed some work.
Fantastic. Well, yes, don't ever swear never to learn to
I
go back,
know.
right?
I know. Yeah.
I was smiling away when you told me that. So tell me, what has been the most surprising, results that you've seen about asthma in pregnancy?
I guess a couple. One was, I guess, from a midwife's point of view, there was really a bit of a split in between midwives saying, yes, it is something that we should know about and manage. And then others saying, no, it's a medical thing. It's not a midwifery thing. We just need to refer them to a doctor. So that was something that I sort of didn't realize would come up. And then the other thing, I guess, was from the women's point of view, where so many of them, again, had very limited knowledge of the effect of asthma on pregnancy or the effect of pregnancy on asthma. And so, many of them obviously had asthma from childhood and really had no idea about, how it may affect their pregnancy and vice versa. So that was just interesting. And also just to see how even a tiny bit of education would change their perception of asthma and pregnancy, and how keen they were to then make sure they had their medication and those kind of things. So so the power of education was really shown from both the women point of view and the midwives. Just that little bit of education, they're all like, oh, okay, no problem, we'll pay more attention to that. So so that was good.
Oh, that is fantastic. So tell me, before the toolkit was developed, and it's now we've got it in the hands of midwives, and we know there's still many who need it, which is fabulous because you're going to get it.
Yeah.
So let's do a before and after. So before the toolkit, as a pregnant woman with asthma, who am I talking to? Where am I getting, where am I getting my information from? Does my MD, family doctor know about it and pregnancy, or does my midwife, or does nobody know? Where are they
Yeah.
going?
That's the problem. That's the problem. So I guess that, what we found was GP is often the first port of call. So the general practitioner is often the first port of call. They diagnose the pregnancy and so on. And usually it's the GP that has been managing the asthma up until that point. And we found a fair bit of, conflict in regard to some GPs being all over it and, recognizing what the appropriate management is and so on, and others really not realizing what needs to happen and taking women off their medications and all those sort of things. So there was quite a variety of responses from GPs in general. And then again, from midwives' point of view, depending on what education they had received or were aware of, as to whether they acknowledged it as an issue, asthma as an issue, and were able to, find resources for the women. I mean, there's so many resources out there. That's the thing.
Hmm.
Even prior to the toolkit, there were still guidelines, national, international guidelines that were easily accessible. But my research showed that very few actually accessed them.
Mm.
So we're certainly hoping that this toolkit, where everything is really put together in a lovely
Hmm.
package and make very accessible, that will, allow GPs and midwives, obstetricians, and anybody who sees women
Hmm.
with asthma, that accessibility to that resource, which will make sure that they have the correct information at their fingertips, which will be great.
That's wonderful. And lastly, before I let you go, what has made you most grateful for throughout this research and, getting this toolkit ready and providing it to, I mean, anywhere in the world, someone can get this toolkit. What are you most grateful for?
I guess I am just grateful that that information is now so accessible to the women,
Mm,
particularly, and that this research has highlighted for women, how they can be empowered to help
mm,
manage their own asthma. And that's certainly what midwifery is about. It's about empowering women to take control of their own health and care. And so that's the thing that I like most about this, that the women can actually then, go to their GP and say, hey, I'm pregnant, I've got asthma, this is what I want from you. You know,
yeah,
I need a script for this, or whatever, So rather than, it all being in the hands of the health professionals, increasing that knowledge for women and their families in regards to asthma and pregnancy, I think is the thing that I hope is the long-lasting, legacy of this. Yeah.
that's beautiful. Yeah, and I think that's what we all live for is empowering our clients to
Yeah,
get that informed decision making happening,
that's
right? Which
right.
is wonderful. But with that tool, it really is critical. So thank you so much. We're very grateful to have you here at Gold Midwifery. Coming up really soon here online. Don't forget you can find out all the details and about Karen's presentation at goldmidwifery.com. Thank you so much once again to Dr. Karen
Pleasure.
McLaughlin for being here today. And of course, to all of you listening in, we'll look forward to seeing you online. Bye bye for now, everyone.